Going to the dentist can be, well, scary. Americans have a lot of reasons for not going to the dentist. They include fear of actually going, inconvenience, and trouble finding a dentist who's covered by insurance.
But the top reason by far is cost. Nearly 60% of Americans said cost was the main reason they haven't visited a dentist within the past 12 months. That's the case regardless of their age, income level, or the type of insurance they have.
That's because dental insurance is, well, wonky. It functions differently than medical insurance, and that can be confusing for patients.
Dental insurance is a mixed bag. It's a misnomer to call it dental insurance because in reality, it's really not insurance, it's reimbursement.
It is frustrating for a consumer when they visit several different offices and they find out that the fees are varying widely.
People may question whether getting dental insurance or even going to the dentist at all is worth it.
The public may look at dentistry as elective. And that's where the problem therein lies.
That mindset can actually drive costs up in the long run. There were roughly 2.2 million emergency room visits in 2016 for dental conditions, according to the American Dental Association. The American Dental Association estimates that diverting these emergency room visits could save $1.7 billion per year.
Preventative care is the key to oral health care and also a key to systemic health care.
The system isn't easy to navigate with or without insurance, but there are ways patients can save at the dentist.
Access is frequently available, but people are unaware of how to access the access.
Let's break down what it actually costs to go to the dentist, whether dental insurance is worth investing in, and what patients and policymakers can do about it.
Dentistry and medicine have always been considered separate fields in terms of the education system, medical records, and benefits.
This separation can also cause some blind spots in treatment.
My name is Dr. Marie Jackson. I'm a general dentist based out of Montclair, New Jersey, and I'm the owner of Stellar Smile Center. A lot of companies cut dental benefits because the mindset is that it is an elective care type of issue. So when these issues come about, people have let it go because they didn't think of it as essential to their well-being.
There's a lot of emerging evidence that what happens in the mouth can impact a lot of chronic disease management.
Your mouth's part of your body. That's the bottom line.
Dental insurance is a nearly $85 billion industry in the U.S. Historically, there have been separate companies for dental and health insurance, but the industry landscape is shifting. More health insurance carriers are now offering dental benefit options, according to a 2020 survey conducted by the firm West Monroe Partners.
Years ago when I went into practice, the big players were Delta and Horizon. Now the big players are the commercial carriers because they've been able to do the formulation to figure out what they need to charge in premium, provide a quality service, but at the same time assure high profitability.
According to West Monroe's data, dental insurers are making plans to stay competitive, with most of those surveyed planning to either partner or bundle benefits with a health insurer by 2025. Much of the dental insurance industry is run at the state level, with some states being more competitive than others. Now, the big publicly traded healthcare companies such as MetLife, Aetna, and Cigna are offering consumers the option to supplement their health insurance with separate dental plans.
Dental insurance is extremely profitable to the insurance companies, which is why many of the major carriers offer dental insurance.
Putting the medical component aside, when it comes to business, dentistry and medicine are better off separate.
Think about when you go to the dentist and how that office is set up versus the office when you go to a physician. When you walk into a dental office, you sit in that operatory. That treatment room costs over $100,000 to set up. And you have to have more than one treatment room. What we provide requires more specific equipment and supplies and also adds to the cost. A dental office operates at a 65% overhead, where a medical office will be considerably lower than that.
These challenges make it very unlikely that dental insurance will combine with medical insurance because it could cause problems for dental offices.
The billing systems are totally different, and so providers would have to switch over to a medical model. That's very daunting to many offices, especially small offices.
Dental benefit plans can sometimes be unclear about pricing, causing problems for both patients and dental offices.
It's a lose-lose all around when we don't have that transparency that we can show to the patient. It's going to be this much, and that's the bottom line. We always say we think it's going to be this much, and then we just cross our fingers and hope that it's going to be true.
I think it's also important for the dental provider to be very transparent and let a patient know costs upfront before the work is done. So if there are any questions, you should be able to get an answer from your provider. You don't want to be hit with a surprise.
In the area where Dr. Jackson works in New Jersey, a dental exam for a new or returning patient is estimated to be around $130 without insurance, according to fairhealthconsumer.org. Dr. Jackson charges a little over $100 for an exam for new patients. That's the out-of-pocket price. But if a patient goes through insurance, FairHealth estimates the dental office would receive around $80 from the insurance company for that visit.
When an insurance carrier takes 35 or 40% off of your usual fee, then becomes very difficult to meet your bottom line in your practice.
Here are the estimated costs for some other common dental services. X-rays, which are crucial for diagnosis, can cost around $185 for a patient without insurance in Montclair, New Jersey. A filling for just one surface can run $250, but if 3 surfaces on the tooth need to be filled, it can go up to $385. A root canal for a front tooth can cost around $1,100, and a crown for a back tooth can range from $1,500 to $1,600, depending on what sort of material is used.
It may seem counterintuitive, but dentists say the best way to avoid high prices is by going to the dentist more.
I think the solution to patients not having huge out-of-pocket dental costs is to stay with the prevention side of it. So if we can reach consumers when they're younger, college age, 20s, we can get the word out that you need to take care of your teeth so that they don't necessarily break down on you down the road.
Getting any type of insurance is about risk. You're paying up front in the event that you're going to end up paying something more in the future. So the question is whether a person feels like that risk is warranted when it comes to dental insurance.
Most dental benefit plans have annual maximums, or the amount of dental care the plan will cover for the whole year.
I think back to when I started practice 38 years ago, the average dental plan covered $1,000 to $1,500 for a patient. And back then, that provided the patient with a decent amount of dentistry, and it really increased access to care for many patients. So they really look forward to having that dental insurance. Well, now if you fast forward 38 years, that insurance maximum is still the same. It's still $1,000 or $1,500, which has not changed while the premiums have gone up.
A typical plan works like this. Patients pay into the plan in several ways. There are monthly premiums, which are typically $25 to $30 according to the data from the National Association of Dental Plans, or the NADP. There can also be deductibles, which is the amount of money a patient has to pay out of pocket before their plan starts to cover any care. Those typically run from $50 to $99. So $360 in premiums per year if you're paying at the high end of the typical rate. Another $100, again, worst case scenario, totals $460. Most plans cover preventative care, such as 1 or 2 cleanings a year and 1 set of x-rays with no out-of-pocket costs to the patient. But the plans vary in coverage when it comes to major services like crowns or surgery. If a person decided not to get insurance, had no other issues with their teeth, and just focused on preventative care, such as getting 2 cleanings a year and 1 set of x-rays, it would cost them around $485 out of pocket. Compared to the $460 a year a hypothetical dental plan may cost, they would essentially break even if they did get insurance. According to the NADP, 95% of Americans do not hit the annual benefit maximum.
It all depends on the patient and what their needs are. So if someone's getting a lot of work done, it is a benefit to them. It does give them a break. It works rather much like a coupon rather than insurance.
According to a study that was put out by the National Association of Dental Plans, 68% of people that don't have dental benefits, they'll actually go and get dental care, but it's a whopping 88% that have dental benefits are actually going to use those benefits.
When it comes to preventive measures, dental insurance is definitely worth it, so you can have some type of method of getting you in so that you're encouraged to make sure your dental health is in check.
Patients have this perception that they need dental insurance to go to the dentist. For many individuals, having access to dental insurance, it does assist them. Does it assist them at the level that it should? It does not. And when you're talking about the maximums that these policies have, it does not assist individuals that truly need it.
It's not just patients who question whether insurance is worth it. Dental offices can sometimes struggle to make ends meet if they decide to accept insurance.
When we take on insurance plans, we're taking a break on fees. So for a small office that has majority insurance patients, if you're in network, you are literally taking a cut of hundreds of thousands of dollars within a year. I've seen figures run up as much as $600,000 of insurance breaks that colleagues of mine have taken in 1 calendar year. You'll find a lot of offices will take insurance plans because if they're a smaller office or new to an area to bring patients in, patients will often look for an in-network provider on their benefit website. So they'll log in, see who's a provider in the area, and it'll draw them to the office.
Dental offices have found ways to help patients who choose to opt out of insurance.
Typically, a membership plan will be a fixed cost per year, and you'll get a certain percentage off of the practice's fees. So, for example, you could end up paying $450 for the year, and then you would get 10 to 15% off of the practice's fees. There's no limitations, there's no deductibles, it's just a straight buy into the practice. They're huge in the dental marketplace now because there is such consumer demand for an insurance alternative.
There's this misnomer that you need dental insurance to go to the dentist. You really don't. Dental insurance is not the panacea that most people think it is.
There are ways people can access lower cost care without policy changes. Another option for low cost care is to tap into dental education programs.
If a patient is able to travel to a dental school, most of the time you'll see dental schools accept Medicaid, and if a person doesn't have Medicaid or Medicare plan, they are able to usually pay out of pocket at a much lower rate than you would at a private office.
There's also the option of going to a community health center, which could provide patients with affordable care. These are federally qualified health centers spread across the country that mainly provide medical services, but some of them also offer dental care.
There is access to dental services through that community health center. Primary care associations are agencies that oversee the function and the efficiencies of health centers. And they help with the very smooth running of health centers who are needed in a particular area. They help with needs assessment and patient access to care.
Policy changes can also be used to help those who struggle to pay. Dentists frequently say that Medicaid, the government-funded health insurance program for low-income Americans, needs to be overhauled in order to help patients.
Medicaid is a wonderful concept, and many offices are able to work with it. However, there's a lot of changes in the Medicaid programs. In some years, you'll have adult Medicaid benefits approved and they're given out. And then when administrations change or midterms come along, sometimes those adult benefits are yanked out or the child benefits are pared down. So it's a very fluid program in most states. And so dentists struggle with that, and they struggle with keeping on top of it.
We know that children do better with their dental appointments and their preventive visits when parents have coverage. The American Dental Association has collaborated with other agencies to advocate for predictable adult dental benefits and an opportunity to change some of the administrative burdens so that it is easier for dentists to participate in a program that they know is here today and will be here tomorrow, not here today and gone tomorrow.
Another issue with Medicaid that I hear very often from dentists is that the reimbursement is just too low. It's not enough for them to even recoup their overhead. There's a huge risk to the livelihood of your practice if you make that a huge chunk of your practice.
If I were to take Medicaid, I wouldn't be able to cover my costs of operations, and I wouldn't be able to stay open.
Ultimately, the best way to save at the dentist is by putting in the long-term investment and care into your teeth.
I'll see patients who may not come in for years at a time because nothing hurt. But the problem is when a patient does come in, we hope to catch things well before something is painful or before something is broken. Preventive care is essential in keeping costs more reasonable in the dentist.